What was Horizon's first name?
Well, it was Erie County Mental Health Services Corporation 2. Really kind of a mouthful. At the time, Erie County Mental Health, the department, managed all mental health services and substance abuse services as they were, but they were limited even so. And what they did was they took Erie County and divided it up into 6 catchment areas. Catchment Area 2 was what subsequently became to be known as Horizon Human Services and then Horizon Health Services.
I worked in the Erie County Legislature for 26 years to a legislator named William Pauley. He met Jim Wigand, who was the former 2-time SPAC CEO. And James Wigand was taking Horizon out of the catchment area kind of thing. He wanted to take it public, private, and move it out to be more away from government control so that Horizon could develop the programs that Jim thought it needed. Unfortunately, about 4 years later, Jim Wigand passed suddenly. He was only 47 years old, but he had already had many discussions with me about Ann Cosentino, who became our second CEO.
I think the biggest challenge that we faced during my time at Horizon was very early in the development of Horizon Village. We had just gotten the approval to be able to go forward with Horizon Village. And Jim Wigand, who was our president at the time, died very unexpectedly and suddenly. And we were, pretty young executives at the time, and Jim was a vibrant and very strong leader. And we mourned his death, pretty heavily. But the crisis created the toughness and the togetherness of the team that made Horizon go forward. We figured out a way to be able to work with each other's talents and to encourage each other, but also to slow each other down. It really became a vehicle that made things happen.
In the very early days, we were a community mental health center. So by government rules, we were supposed to stay within a certain territory. But because Horizon wasn't funded by the government, we could do whatever we wanted, and we started an expansion.
We spread to Cheektowaga. We spread to the South Towns. We were blowing away those catchment area lines. We spread to Bailey Avenue, spread to Niagara Falls, and that was a major structural change because we were crossing county lines.
When I first started, we were operating out of church basements across our communities. And over the years, we were able to build onto 22 different facilities across multiple counties.
I would say the first huge milestone was opening up Horizon Village in 1994.
When I first started at Horizon, it was honestly a pile of dirt that we purchased, out in Sanborn. And the first 2 years that I was in-house, we worked on getting the approvals for Horizon Village, and then, the development through the years and the addition of Terrace House, just an incredible accomplishment.
Being on the campus as it's grown. So when I started, Horizon Village was obviously there. Horizon Village has been there since 1994, but that was the only building on the campus. And then the Wellness Center in 2011, Freedom Village in 2013, we opened Delta Village in 2016, and we opened Aurora Village in 2018, and then we opened Hillary's House in 2023.
But every building that we opened, every time we moved to something bigger, meant that we were meeting more needs in the community, and that was spectacular.
What I've enjoyed watching most is watching Horizon evolve in the intentionality of the services that we bring to the community, really paying attention to what is needed out there and growing purposefully.
I think along the way, it's very easy to expand unintentionally, but I think what we did is really expand intentionally. We thought about what programs we needed, we thought about what our community needed, and we had targeted growth. So for example, we created IOP tracks for our mental health patients, an IOP track for our substance use patients. We're doing adolescents in childcare. We're in schools, and we also focus on perinatal and postpartum patients. We've just started to get a better understanding of what our community needs and then figure out what programming we can offer so our growth is intentional to service our community and their needs.
When Horizon went from just a mental health agency and we started doing substance use and addiction treatment, oh my God, what a change in culture, what a change in just who we hired and how we spoke about patients and care. It was pretty amazing.
Strategy for Horizon, I believe, was to always keep our eye on the future of the community and what was going on in the community and what we kind of thought what was going on in the community. And at the time, the CEO that I always worked under was Ann Constantino, and she had a gift for seeing what was going to happen next. And our job was to be ready for that and to help the community be ready for that and to help funders be ready for that and regulators so that they would say, yes, these things are going to need to be happen. So we were innovative, we were creative, we were developing things, and we just found a way to make those things happen, so both for patient care and for employees. Because if you don't have a workforce, you're not going to be able to take care of patients. And so we were pretty good at seeing what employees wanted at the time also.
I feel it's been just a privilege to actually watch the company grow from less than 200 people, less than $14 million budget to 4 times that. And in that run, the markers that stand out are deciding to have a marketing program. We did the marketing ourselves, Ann and I, and just launching that program, or centralizing admissions. For a long time, people just got scheduled wherever they happened to call that site. And so we centralized a lot of services. Just watching the company legitimize itself and grow into this, pretty large ecosystem that we are.
Not only have we grown in size, but I think we really have become one of the most sophisticated and reputable programs for behavioral health in New York State. Anytime I go somewhere, people are intrigued at the quality work we're doing, the data that we're looking at, the strategic visioning that we're having. And so when I look at the evolution, it's that we're always growing in our ability to stretch outside of our comfort zone, growing in our ability to really look at different ways to approach patient engagement and care. And so the evolution for us is just part of our DNA. We want to do those things. And so what I see not only us getting more sophisticated, but really us getting to be the best version we want to be every day.